Mystery illnesses. This is the last of our five-part saga on mystery illnesses, what they are. We've talked about Lyme, we've talked about mold, autoimmune issues, dysautonomia, and the last of these mystery illnesses I want to talk about is Mast Cell Activation Syndrome. Now, this may be a new term to some people, but it's actually quite common. According to research from Dr. Molderings in Germany, 19% of Germans test positive for this. So what does that mean? That means that it's probably pretty common here in the United States as well. We have a little more diverse population here than in Germany, but point being, Northern European descent, 19%, that's pretty common. So what does Mast Cell Activation Syndrome look like? Some people refer to it as histamine intolerance. Sometimes it can look like flushing. People have issues with food reactivity. It can have sensitivities, multiple chemical sensitivities. It can look like fatigue, shortness of breath. One form is actually people get anaphylaxis spontaneously for no known reason. You can get GI tract issues, rectal itching, malabsorption, gas, bloating, a whole bunch of gut problems. You can get stomatitis, mouth issues. You can actually have dental problems. There's actually certain cancers associated with Mast Cell Activation Syndrome, different recurrent infections, thinning of your bones, hormonal problems, osteoporosis. And there's a list of 30, 40 plus different parts of your body that can be affected by Mast Cell Activation Syndrome. It's a great imitator. So how do you make the diagnosis? Well, one, there's actually some symptom questionnaires we use in our clinic to kind of walk people through to see if they cluster in this area. Again, realize there's a lot of crossover with mast cell and the other mystery illnesses, and they can be triggers for mast cell activation. So if someone has a lot of the symptoms, doing labs is helpful. The problem with doing lab testing in this entity is that the labs, the markers themselves, some of them live seconds or minutes. And so if the blood isn't processed just the right way, they're not caught just the right time, the testing results will be negative, and you might think someone doesn't have this, but they really do. And unfortunately, when people go to the emergency room, they feel really sick, they tend not to be able to get the testing done the right way because emergency rooms are not familiar with this illness as well. So we tend to do things called therapeutic trials, where if someone's having POTS or dysautonomia and gut issues and reactions, we'll use cromolyn or H1H2 blockers, which would be Claritin, Pepcid, using nutritional things, resveratrol, quercetin. And some people are so bad you actually use biologics, different medications to help block mast cell responses. But the really thing with currently the way mast cell activation syndrome is dealt with is with these things called therapeutic trials, where you list things out. And I have a list we give the patients that they walk through. But the point is that mast cell activation syndrome is complicated, involves multiple systems. Lab testing is not amazing. Even when done the right way. You actually are supposed to do 3 different lab tests at 3 different times. You need 3 times they're negative, which again, it's hard to people to do that, especially when you need to get off all your medications and supplements that might be helping you feel better. And then all the things I mentioned previously, mold, Lyme, autoimmune issues, POTS and dysautonomia, they can all be part of or triggers of mast cell activation syndrome. So if you're having multiple symptoms and multiple systems of your body, you're having these mystery illnesses that no one can quite put their finger on, then you probably should be working with someone who can kind of help you walk you through these things. They can deal with everything I mentioned. And there's other mystery illnesses that are out there that I haven't gone into, things related to oxalates and yeast overgrowth. The reality is there's a whole ecosystem. Maybe we should make a specialty, a mystery illness specialist, which in many ways is kind of what we do, because you have to have a whole body system approach. Question I have for you all out there today is has anybody out there been diagnosed with mast cell activation syndrome, had histamine issues? What was your journey? Typically, it takes several different doctors or practitioners to work with before you get the diagnosis. What was your journey? How long did it take for you to get the diagnosis, and what did you go through? I think sharing this is helpful because it helps other people see that they're not alone, and also gives people information what they need to advocate for, and ultimately need to work with a practitioner who's familiar with these different mystery illnesses that can help walk them through this as well. This information is helpful. Please like, share, subscribe. I'd be curious to hear your story if you're one of these mast cell individuals as well. And that ends our 5-part series on talking about mystery illnesses, which one you might have, what to think about, especially. And the reality is with all of these, they are actually quite common. I didn't actually talk about this previously, so I guess I'll mention it here since one's a little shorter. According to the CDC, there are as many new cases of Lyme disease in our country as cases of breast cancer every year. With mold, half of all buildings have water damage in our country, and 23% of the population has the gene that increases their susceptibility to that. Autoimmune issues, maybe 20% of the population has antibodies related to autoimmune issues. In certain populations, it's pretty, and then it gets more common as you get older. POTS and dysautonomia, some of the POTS information says maybe 3 to 5% of the population has POTS. When you add in dysautonomia in general, like the mild forms, it's probably closer to 10% has some type of dysautonomia. And then mast cell activation syndrome from Dr. Moldering's work, maybe 19% of the population has it. And the thing I think it's interesting is the numbers with Lyme and mold, they're very similar numbers. And so there's a ton of overlap between these. These five characters don't come alone, they tend to come together. And so then having an ability to address all those is super huge when dealing with a chronic health issue that, again, is mystery type illness. If you have your own mystery illness that I haven't mentioned, I'd be curious what it is. Put it below. Maybe it's something we're aware of and we could talk about. Maybe it's a new one to us. I'm always open to learning new things. So if you have a mystery illness you've been dealing with and you want to share, I'd love to hear about it. Take care and we'll talk to you soon.